and our priorities have been focusing on the people that are most vulnerable, as well as those folks who are in really high contact healthcare settings. And the reason for both of those is the folks, for example, in long-term care facilities have had the worst clinical outcomes by far of any group in the United States. And so we've put a lot of resources into protecting long-term care facilities, and I think it's been effective at mitigating. But no matter what you do, this thing finds a way at some point in time. And so to be able to have vaccines available for the most vulnerable residents, that'll be something that'll really be a game changer. It'll reduce mortality. And I think less discussed, it will allow these facilities to return to normal. We've thought it was very important to have visitation because these folks were really in a state of loneliness. That's been helpful to a lot of people, but they still have a lot of mitigation because obviously you want to keep this out of there. And a lot of the facilities have a lot of very rigorous requirements. That takes a toll. And so to be able to have a more normal environment for those elderly residents of long-term care, I think is going to be really, really important. On the healthcare side, there was a lot said at the beginning of this pandemic about massive shortages of hospital beds, and there were all these models. All of those were inaccurate, wildly inaccurate. There's not been any bed shortage anywhere in the country. But I think what we found is when you have higher traffic, particularly like we saw in the Northeast in the spring and the Sun Belt in the summer, and then just now in the Midwest, this is very labor intensive for healthcare workers. And so you have isolation procedures, and of course, not everyone who has COVID in the hospital is necessarily being treated for it, but you got a broken leg and you're COVID positive, they're still doing those types of procedures to make sure they limit the spread. One exposure, one infection could have a bunch of exposures. You end up isolating 10, 12 medical personnel at a time. That really taxes the workforce. So part of it, they're in more harm's way in dealing with sick patients, but part of it is also making sure that we have a stable workforce, because coronavirus is part. I mean, in Florida right now, it's less than 10% of the licensed beds are COVID positive patients. You have a lot of people for a lot of other things. We want to make sure the system's working for everyone. So that's kind of why those two at the front with limited vaccine. And what we're doing is, out of 180,000 doses, we're doing a little less than 100,000 to the hospitals for use with healthcare workers. Now, we were limited by the federal government to 5 facilities, and so what we tried to do was just pick big systems in big parts of the state. So you have here Tampa General, who's obviously a big system. UF Shands in Jacksonville, Advent in Orlando, 2 of the big systems in South Florida. That they have the storage capacity to store it for -70. Most hospitals do, but not all. And so that's kind of the way that went. It was because of the HHS saying you can only have it there. What they wanted to do was beta test it to make sure that this worked in terms of the delivery mechanism. And they felt that if we had it sent to 50 hospital systems and there was problems, that it would really exacerbate kind of the rollout of this. So if you go through 5 hospital systems, if the shipping works, receipt works, everything works, then next week we'll be able to expand it into other hospitals. Now that said, we've told the hospitals, look, we want your tip of the sphere workers, we want the folks who are in the highest contact. You're clearly going to have more vaccine than just you need in your system. So they're working with other systems in their areas and even beyond the areas. I know Tampa General's working down with folks in Southwest Florida like Lee Memorial. So we want to say not limited to those 5 hospital system workers. We want to get as many of those frontline, the ED docs, nurses, ICU nurses, all those folks, the opportunity to do it. Now, I think what the hospitals are finding is there's about a 50% rate of saying they want to take it right now. So whatever the number they have in terms of who would qualify as high contact, you are not needing enough vaccine for all of that because the demand's not quite there. That may change as we go forward, but you're going to be able to do that. And so Tampa General folks are going to get it, but so will the other healthcare systems here. And then we'll continue sending as we get new vaccine shipments. We want to obviously knock out those key people, but the goal will be once we get the EUA for Moderna, which we think we'll get next week, that ends up being, we'll get more Moderna next week than we're getting Pfizer in the coming week, and that will hopefully, if everything continues to go like we think in terms of the distribution keeps flowing, my goal after the long-term care facilities and in terms of the hospital workers would be getting it out to the elderly and the senior citizen, the broader population. That's where most of the risk is, and if we're able to do that, that is going to really, really help reduce mortality, reduce morbidity. We, for the long-term care for this week, what we did, CVS and Walgreens are contracted with HHS to go into these facilities. This is what they do. They go in and they do flu shots. They do other things. So they have a model and they're able to go. So of the almost 90,000 doses that are going to be for those facilities, we gave the vast majority to them this first week, but we also have about 25,000 doses for the Florida Department of Health to go into areas, and Pinellas is going to be one, I think Broward the other, because they have a lot of facilities, high concentration of facilities. We have strike teams. We're going to go in and try to knock out as many facilities in that first week as we can. We're doing that just simply because we had some mixed signals from the bureaucracy about when CVS and Walgreens would be allowed to start. We think that they should be allowed to start at the beginning, and we're working with them to do it, but we didn't want to see a gap, and so this guarantees that as soon as these come, we're going to then work to get folks in those areas vaccinated, and that'll primarily be the residents, although we are going to vaccinate, offer the vaccination for the staff members, which is very important as well. We have almost 4,000 facilities, long-term care facilities in the state of Florida. We want to get through as many of those in conjunction with CVS and Walgreens, as quickly as we can. It's one dose of this Pfizer, their finding is protective. There was actually an article in the Wall Street Journal, someone argued you shouldn't even do the boosters with Pfizer right now, just get as many doses out there. I'm not sure that Pfizer would agree or FDA would agree, but I think just the point is getting that first dose out really does make a difference, and I think you'll see that. Right now we have a little more than 1% in terms of cases in long-term care facilities. It's kind of been between that. It's been a little bit in that area now for a few weeks. It was much higher over the summer. It was lower 6 weeks ago, and we've done more resources to there to try to just keep it as low as possible, because we really feel when you go in and get the first dose, after a week or two, you will see a decline in infections, and it's low. The infection rate's still low there, but to hold the line there and to get as much vaccine out, of course we will do the booster, and for whatever they're sending us, they're keeping the same amount in reserve. They are not saying that we have to keep the booster in reserve. You use what you have, then they send the booster for the people that have already had it. And I think that probably makes a lot of sense, because you didn't want to be in a situation where someone needs a shot, but you say, well, I got to hold these because these people are going to need it in 20 days or 21 days. So that's how they're doing that. So getting through the long-term care, getting those tip-of-the-spear healthcare workers, and then getting it out into the broader senior population. We think the Moderna production is going to dramatically enhance the ability to vaccinate more people. We're not sure what the Pfizer is going to look like after this first week. We initially had an allotment, and now they're saying they're not sure about it, so we're obviously at the mercy of that. I mean, our hospitals aren't going to be able to vaccinate people if they don't have the vaccine being delivered, but we're confident that the Moderna will be approved, and then as we continue to get Moderna and hopefully more Pfizer through December, and January is supposed to ramp up even more. We're looking forward to the Johnson & Johnson phase 3 results, and for Johnson & Johnson filing for emergency use authorization. The Pfizer requires extraordinary storage at -70. Moderna is normal freezer. Johnson & Johnson just normal refrigeration, and so it's one dose. So we get that produced to scale. If you do have an approval sometime in January or beginning of February, that starts shipping. You then have really dramatically increased the ability for people to have access to this vaccine. I don't know how much is going to be distributed in January. Again, there's estimates. They said they think 30 million Americans in the month of January between Pfizer and Moderna, but we'll see if that ends up coming through. If that's true, and then you have 20 million in December, I mean, that's a big chunk of the at-risk population. I mean, that is going to make a huge difference. As you get the Johnson & Johnson, obviously we want all the elderly to have access, but then also like these firefighters and police and teachers and all those folks, you're going to be able to offer that, I think, on a more broad basis for folks who are in more high-risk environments. I mean, these firefighters, police officers who are dealing with folks on a day-to-day basis, I mean, they're not going to test someone before they go and answer a call. And so that's just what they do on a day-to-day basis. So I think that's really something that we're looking forward to on the Johnson & Johnson front. So we hope to get the formal approval. Secretary Azar said today it was coming, and I talked to Steve Hahn last week, and he thought that once the recommendation came on, that the full FDA would move very, very quickly. So if it's approved today, you could start to see it be shipped within 24 or 48 hours. And I know the hospitals are ready, and I know CVS and Walgreens are ready, and the state of Florida is ready. So that's exciting. It's good news. A lot of people said it would take 1.5 to 2 years at a minimum. It turns out that there was a lot of ingenuity and innovation, a lot of manpower put into this, and this is going to have a really, really big difference for the next many months, and it will end up a lot better off having access to this than if we didn't. So today, I'm really happy. We have some great folks with us today. Of course, our wonderful First Lady who you know, people will ask like, oh, did you enjoy your Thanksgiving or whatever? Like, yeah, you know, I got to spend a little more time at home, but the kids put us through our paces, and she certainly, so there's really no rest, and she finds a way to handle 3 little ones and do a lot of great stuff for the state of Florida. Of course, mental health has been one of the things that she's been most passionate about. We also have Chad Popple, our DCF secretary. Want to thank Chad for all his hard work. We have the newly minted Speaker of the Florida House, Tampa Bay's own Chris Sproul. So it's good to have you, Chris. We also have Megan Vila. Thank you for coming, and she'll tell her story about her brother's struggle with mental health, and she's really doing a lot to help folks. We have Clara Reynolds, President and CEO of the Crisis Center of Tampa Bay. Thanks for being with us again. And then we have Donna Luzinski, Chief Deputy, Hillsborough County Sheriff's Office. So we want to thank you, and thank you for all you and your deputies and the Sheriff's Department have done all the time, but certainly over these last many months. We really appreciate your service. Thank you. Well, I don't think anyone would need, and you see different statistics about the mental toll that we've seen since the coronavirus pandemic. I think it's pretty obvious. I think people look and they see, and that could be everything from somebody who's in a long-term care facility who has not been able to see family as much as they want. It could be people who are hospitalized and then they don't have family, and not just for COVID, they don't have family there. It could be for people who, fortunately, we have kids in school here in Florida, but you know, it's been tough on a lot of kids, particularly in states where they've banned school and they don't have the in-person school, they don't have athletics, they don't have events. Individuals who have to provide for their family. It's been a difficult situation. So you see mental health has been something that's been underlooked for too long. It's something that the First Lady has been working on before the pandemic, but we really believe that this should cause us to redouble our efforts. Understand we've lost some ground over these last many months. I mean, if you look at some of the statistics for things like opioid overdose, people have been working really hard on that. I think gains had been made. Man, you really see some movement backwards. Hopefully we're stabilized and going forward now better, but this is going to be something that's going to be a perennial issue. You don't just have things like this happen and it just all of a sudden go away. So we really believe that focusing on this is important. You know, there was actually a report last night from the grand jury that we did when I first became governor about the Parkland. They're citing the need for mental health, particularly in schools, and some of the things that I think they recommend is exactly what the First Lady has been working on anyways. So I think the time is right to be able to announce that today the state of Florida is going to be allocating more than $23 million to support our state mental health services system, and we're going to use this money from the Federal CARES Act. The effects of the pandemic on mental health have been significant, and these funds are an important resource to help Floridians recover from COVID-19. Now, this additional funding is going to allow us to expand community-based programs and services within our state mental health treatment facilities to enhance the system of care for children and adults. What we're going to do with the new funding is $18 million of it is going to go to community-based services, and we're going to target those areas that have the greatest need. We're going to expand the capacity of Florida Assertive Community Teams, FACT teams, to serve up to an additional 300 adults with severe and persistent mental illness. This will allow comprehensive care to be provided in the community and hopefully decrease Baker Acts, emergency room visits, and jail utilization. We're also expanding community action teams, CAT teams, for children and youth who are at risk of out-of-home placement due to mental health or co-occurring substance abuse disorder. We will serve up to 375 additional children with comprehensive services, including crisis intervention, psychiatric services, and counseling. We are providing funding to enhance care coordination for children and parents in the child welfare system who have behavioral health needs, as well as those patients discharged from Baker Act facilities, EDs, or jails to ensure prompt and appropriate access to service. In addition, the funding will expand family intensive treatment, team services for families involved in the child welfare system with a parent who suffers from a substance abuse disorder. We'll also provide increased access to short-term residential treatment for those individuals who require a higher level of care for a short period of time, providing an additional 24 beds for the year. We'll also establish care coordination, housing, employment, and peer support from those who have experienced similar challenges to those families with babies who have neonatal abstinence syndrome or substance-exposed newborns. In 2018, more than 1,500 children were born with neonatal abstinence syndrome. We're also going to expand 211 coverage to improve access to care and divert families from the child welfare system and from dependency on the economic self-sufficiency programs of the state. And we're providing $4.5 million to enhance state mental health treatment facility services, which will establish a jail-based diversion pilot program to divert patients from the state mental health treatment facilities. These pilot programs will provide competency restoration and mental health services in the jail setting with the goal of transferring the individual to a community setting for additional services rather than an institutional setting. We're also going to initiate a pilot to allow 30 days of coverage for care in a nursing home or assisted living facility for patients being discharged from one of the state mental health treatment facilities. And right now, patients have to wait until they're actually discharged from the state mental health facility before they're eligible for Medicaid or Medicare, which takes approximately 30 days from discharge. Nursing homes and assisted living facilities are understandably hesitant to admit these patients prior to receiving their Medicare or Medicaid benefits. This funding will expedite that process. We'll also provide enhancements to state facility systems, which will improve efficiencies of the medical staff, enhance communications, increase resident safety and employee safety, and make it possible to use other technologies like telehealth. So we think that this is a well thought out package. Of course, we've spent an awful lot of money on things like testing and staff and National Guard and all the way down the line. This is something that is absolutely critical in terms of responding to COVID-19. Understanding that the fallout from the pandemic is not simply limited to someone that may get admitted to a hospital for COVID, that it extends far beyond that into every community in the state of Florida, and we need to face it head on. It's not an easy problem to deal with under any circumstances, but we think that this significant amount of resources is important. We think it's justified, and we think it'll make a difference. And so I have the First Lady here to talk more about some of the stuff that we're doing, not just with the money that I just discussed, but also some of her other initiatives, as well as support we have for first responders. So take it away.
Well, I appreciate that. I think everything that the governor talks about is something that I think people need to hear a lot of, and that is hope. Hope comes in a lot of forms. I think hope comes in everything that you heard about the vaccines and the therapeutics, hope of a return to normalcy, hope in unprecedented amounts of resources going towards mental health. As you heard just a second ago, we understand full well that people are suffering, and that extends beyond just the virus. There are people who are suffering at home in isolation. One of the worst things that you can do when you're depressed is isolate. And so those people are oftentimes suffering in silence, and we're trying to provide them with resources and outlets. I'd say hope also comes in the form of, when we talked about the grand jury report coming out last night, hope comes in the form of collaboration that I think the Secretary can say that we have done with the state agencies. That was really the underpinning through the guidance and the really profound statements that came from the governor. I don't want to give him credit for that, but when we met back in 2019 at the governor's mansion, we did a mental health listening session, and he said something that has resonated, I think, with all of us from the very beginning. He said, "I don't want you state agencies to work in silos. Furthermore, we understand that this isn't a top-down approach, that we have to work with our communities, the good people on the ground who understand the needs best that their citizens require." So working beyond just government, it's not the solution, it's part of the solution, we always say, and it is working with the nonprofits, the private sector, law enforcement, our educators, our first responders, making sure that we're looking at it from all sides, so we're maximizing the resources, we're monitoring our progress, and we're looking for meaningful outcomes. And when we talk about meaningful outcomes, it's the well-being of the people of this state, which is of the utmost importance. If everyone is happy, healthy, and productive, then going forward, it's going to be best overall for not only families but for the state. And so that's one of the things we're really working on. Another thing comes in the form of hope is when we talk about, in addition to the $23 million that the governor talked about, there's a $4.9 million grant through the Department of Children and Families targeted towards 211. And one of the groups of folks, although there's a lot of people who are suffering, who are really suffering through this pandemic, and I would say do so silently, because they take an oath to serve the people of their communities, and they go out doing it day in and day out, don't ask for much and do their jobs, are our law enforcement and our first responders. These are heroic men and women who see some of the most unbelievable things day in and day out, and that they come home to their families, they put on a good face, they do what they need to do to be able to be the best people possible, but we know that it's tough. Now, I would invoke some of the stories that I heard when Megan came to the mansion last year and we did a first responder mental health listening session. And I don't think there was a dry eye in the room, because there were some people that really took the opportunity to open up about what they see and how they try to cope. So one of the exciting things that we're going to do with this $4.9 million, and we're going to try to work with the federal government to make sure that this is all in compliance. But Clara has done some amazing things at 211, well, in a lot of ways, but specifically for our veterans. Because one thing that we've learned about mental health is the relatability and being able to talk to a peer. So at the Tampa Bay Crisis Center, as you all know, and they are the gold standard, they're doing wonderful things and really a model for the state. They're working with our veterans. And so if a veteran is thinking about, unfortunately, committing suicide or needs help from a mental health capacity, they can call the Tampa Bay Crisis Center and they can get patched through to a peer, to someone who has relatable experiences, so that way they can be able to talk to someone who understands the perspective from where they're coming from. And so what we are excited to do is to work with our federal partners, to work with the Secretary, to work with our local folks, to be able to provide that same opportunity for the good folks in law enforcement and our first responders, because they need an outlet, they need a peer, they need someone that they can call, they know that they can relate to, who understands what they endure day in and day out, but can also do so anonymously, so that way they're not fearful of repercussions. Unfortunately, there's a lot of negative stigma still associated with mental health. I'm excited in the form of hope too, because coming up in the new year, we're going to have a lot of really exciting announcements about things that we're going to be doing to try to change the way that mental health is looked at. Really, as the Secretary would say, get upstream from a lot of this and to talk about it is okay to seek help, and what does that mean, and what does it mean to be resilient, and what does it mean to be able to seek resources. But to be able to work with the Secretary through the governor's vision, to be able to deliver to our great first responders and our law enforcement, to give them something that they can utilize, given all that they have endured and all that they have done to sacrifice for our communities. I think this is a big day, and it shows that, you know, we are going to, as the governor says, tackle this head on. We're here to support you. We're not only utilizing these resources, but we're also utilizing our great communities to collaborate. Another great announcement that'll be coming out at the start of the year, but to collaborate in a meaningful way to maximize all of the good work, all of the silos that the people are doing across the state and communities, to work together with a common goal to make sure that we have meaningful outcomes. So I'm excited to be able to be a part of this, and I'll just say I'm very, very humbled in this capacity to be able to sit in a room with such wonderful people and to be able to find a way to help. So thank you.
Well, thank you. Really appreciate all the hard work, and I know it's not easy because I see every day.
I talked to a 3-year-old for 2 hours this morning, so that was dumb.
So, but it is actually, though, we're excited because Mason, this is the first time he will understand Santa Claus. So he knows Santa, he points, and they're watching Mickey Mouse Christmas a lot. And Madison, of course, is a pro at this now, but it'll be both of them going. Last year, it was like Mason just kind of was like in La La Land. He was 1.5 or 1 point of that. But we're excited to give him the opportunity to do his first real Christmas. So, Chad, take it away.
Governor, First Lady, thank you for having me here today. I'm really excited, and I want to thank the governor. I mean, the announcements he just made. I mean, he asked, "What do you need?" And so that's really powerful for our team, and we're excited about those announcements. And one of the things I wanted to point out, all of those teams that the governor was talking about, your CAT teams, your FACT teams, those services take place in the home. And so to the First Lady's point, can we get involved early enough to keep the situation from degrading? The care coordination, all of that is all designed to keep things in the community, in the home. We work with great partners, so we're really thrilled about being able to really bolster our system at this time. And in this backdrop, it's not lost on me that we call you guys heroes. And I think most people think that's because you go into really dangerous situations or burning buildings and things of that nature. But the more I've worked in government, I've gotten to work alongside law enforcement and firefighters and paramedics. It's the toll the job takes, going one time after another into a situation that most people hopefully will never go through. They go through it all the time. And so the word hero has taken on a different meaning for me. It's because you are sacrificing part of yourself in this job. And I just want to say, before COVID, SAMHSA had released some information. Your EMT professionals that had contemplated suicide was nearly 10 times the rate of American adults. That's prior to COVID. That's prior to COVID. And so it kind of gives a new meaning to what a hero is. And so you don't need to hear me talk. The story you're going to tell is so powerful. I remember it vividly from a year ago. But it does speak to the need for folks, for services to be there. And I want everyone to know that help is there. You don't need insurance. Our community-based systems are there for you. You can call 211 and get whatever help you need. That's one of the things I'm most proud to be able to tell the governor. Throughout all of COVID, our systems never went down. They had a big-time stress test, but we were always able to answer the phone and get services to folks that need it. And so if you need help, if you are struggling, call 211. It's very simple, and we will rally around you. Particularly, I know there's a lot of resources in the law enforcement community, and you guys can talk to stigma and some reluctance to reach out, but there's other ways to get help. I want everyone to know that. So I am honored to be here, privileged to be here, and I look forward to hearing from you guys. Thank you, Governor.
Thank you. Mr. Speaker?
Yeah. Well, thank you all. Thank you, Governor and First Lady, for doing this. We're lucky to live in a state where we have, leadership matters, and leadership on the issue of mental health. I'm sure that the chief and the firefighters who are here would agree that 20 years ago, we wouldn't be sitting in a room having this conversation. We wouldn't have a governor, we wouldn't have a First Lady who would make this a priority to make sure that folks like us are in a room so that we're all working together. And, as a prosecutor for a number of years, I got to work with law enforcement officers every day and see what they experienced, work with our firefighters and paramedics who showed up to treat victims of crimes. Unfortunately, I had to take part in some situations where some children were hurt or abused, and certainly lots of folks who were in the crisis intervention system and hopefully had reached out beforehand, but some hadn't and needed help after the fact from folks like victim advocates and so forth. And the governor and First Lady are right. I mean, really, us getting ahead of this is what really makes the difference. And I think what's important about the announcement today, Governor, is that commitment of realizing that not only have we known that this is a problem that has touched families in a very, very significant way for a number of years, but now in this inflection point that we're dealing with with COVID, we realize that, as we get closer to getting the vaccine, that there's going to be lingering issues that are going to be, mental health related. We've seen domestic violence be an issue during this pandemic. Realizing that our cops and our firefighters are now having to add just an extra layer, what was already a difficult, stressful job. Every time they come into contact with someone on the street or show up to treat somebody medically, there's now an added layer of stress, to that interaction. And same is true for our DCF caseworkers, already one of the most difficult and stressful jobs in the state. Having to dealing with that and going into people's homes. So I think this is wildly important. Particularly appreciative of the First Lady. Last session we worked on child welfare issues. You were a champion of that. You've championed this. For some reason they prefer, I think, to listen to you than people like me and the governor. But so we appreciate your leadership very, very much. That's right. That's right. The kids. So thank you all for doing what you do, and thank you for leading on this.
Great. Megan, thank you for being in Tallahassee when we had the previous event, and thank you for being here today. So why don't you tell your story?
Well, first of all, I want to say I'm honored to be here. It actually was a year ago yesterday that I was at the mansion and meeting with you. Wow. Yep. And I can't believe it's been 3 years, but 3 years ago in 2017, my brother Stevie Ledoux took his life after after 30 years on the Tampa Fire Department. And I'm a lucky wife to a captain on the Tampa Fire Department, and I have a baby brother who's on the fire department and 3 nephews. So this, for our family, really touches home. And 3 years ago, when my brother took his life and he came forward, he was a hero for coming forward. He did not have the resources, and the leadership was not set in place. The laws were different, and the stigma back then was even worse than it is today. And I am so proud to be sitting here. It is no mistake that your initiative is Hope for Healing. The 2017 legislative, they decided to name the road in front of my brother's highway Stevie Ledoux Giving Hope Highway. And that speaks volumes because there is hope. So any first responder that is struggling because of years on the job of things that they've seen and they are in fear of coming forward, I just urge them to come forward. We are only one family that went through something so tragic, and I don't want another family to experience the same tragedy. And what these men and women go through, especially now with COVID, I mean, we have 6 children at home, and my husband has to go into people's homes not knowing if he's going to bring it home to us. The stress on top of that and the things that they see on a daily basis, it truly affects them. And I cannot thank you enough for what you're doing. We sat right here in this room when Governor Rick Scott changed the law, and now to be sitting here with you, Governor DeSantis and First Lady, that you know that this is an issue. And that speaks volumes. And actually one of the fire chiefs said it when we were talking upstairs. It is so important that it is from leadership down to the day one firefighter and everybody in the middle, that you can come forward, you can talk about it. There's not going to be fear of you losing your job. They're going to provide these resources to get help. And I am just so proud, and I know my brother is proud, that this is making such a difference. And I, from the bottom of my heart, thank you. Yep.
Thank you.
Yeah.
We really appreciate it. Clara Reynolds.
Thank you, and I echo exactly what everyone else has said. Thank you. Thank you for your leadership. Thank you for your willingness to go down this road with us. We recognized at the Crisis Center of Tampa Bay that there are so many individuals in our community that still don't know we're here. Our biggest area, though, has been with our first responders. So in September 10th of 2019, we did launch a campaign called LastToAsk.com. This was done in collaboration with Chapel Roberts. It's a local advertising agency. They were very passionate. They had a lot of vision and a lot of heart around this issue. It was very personal for them. We were able to take this campaign and roll it out across our community, and we now have a statewide number. It's 1-866-4FL-HERO or 1-866-435-4376. It's available 24 hours a day, 7 days a week. Right now, that line is not answered by first responders. That is our goal. That is where we hope to get, because exactly what the First Lady said, our veteran support line has been so successful because it is one veteran talking to another veteran. That is the secret sauce, and we believe that being able to launch a very similar initiative with first responders, answering those calls from other first responders, will truly make the difference. That line has been in operation for a year, and I am very sorry to say we have not seen the numbers that we would hope to. Thank you for giving us this opportunity. I think we've all talked about it. Stigma is the biggest thing that we are all dealing with, but there's no bigger stigma than in our first responder system. There's a lot of misconceptions and misnomers, and so thank you. Thank you for the leadership, Chief Lazinski. Thank you for the leadership, Chief Jones, to make it okay. It's okay to not be okay. What's not okay is not reaching out for help, and this line is available, as well as 211, 24 hours a day, 7 days a week. So thank you, truly, from the bottom of my heart, that we have been given this opportunity to talk about what's happening here today, and to bring light to a place that has been in the darkness for way too long. So thank you.
Thank you. Donald Lazinski?
We support you and the First Lady's, we appreciate you and the First Lady's support on this. Not only these initiatives and the funding, we respond to calls for service every day that deal with mental health issues. So it's so important that those people in our community get help and the services we need. But more importantly, we truly appreciate your efforts with first responders. As everybody here has said, our first responders, our firefighters, our police, our deputies, they see things that are so disturbing, and it builds up over time. And COVID has exacerbated that to a degree. As you said, your family, they don't know what they're bringing home. Are they bringing home COVID? But these efforts will go so far. We need it from the top down for our people to see that it is okay to not be okay, but we want them to get services. We do start in our academies teaching them about resiliency and wellness. But when we have the support at this level, it means so much. So we truly appreciate your efforts in our community.
Great. How, just aside from this, how has the crime situation been since the pandemic hit?
In the beginning, it was very much down. Now we're seeing some violent crime spike. We've had a number of shootings in our area with the Tampa Police Department, and we're really working to combat that because it is concerning. You know, we have a shooting at a park where people are playing basketball. You know, you should be there safe there. Go to bring outlets, but it has increased a little bit as far as shootings, and it's something we're certainly focusing on.
Well, we support your efforts. I think that it's increased dramatically in parts of the country where they've basically turned their back on law enforcement, and we just see that doesn't work. It's not right, and so we'll be with you here in the state of Florida. But I do see what happens in these other areas, and I think we've done a better job here. But you know, there is going to be fallout, you know, from this pandemic, and we want to have our folks with the support to help protect the community. So thank you for what you guys are doing.
And our community has been supportive here. We are very fortunate.
Yeah, good. All right, well, thanks everybody. We really appreciate it, and this is an exciting announcement. Hopefully it'll really affect positively a lot of people's lives. Happy to take a question or two. Realistically, I would do that if we could, but realistically, this is the feds working. I mean, they're on, like, if I went to Pfizer's dealing with the federal government. I mean, that's just the reality of the situation. Same with Moderna. Of course, Pfizer, they knew there'd be federal money to buy it. Moderna worked on R&D with the feds since the beginning of the year. So they're working very closely together. And I think J&J has produced it enough at scale that that's really going to expand dramatically when that comes. But if there was a way for me to do it, I would. But it's just, it is literally, they are working with Pfizer, for example. How much was produced last week? How much is ready to ship? And then the allocations go out to the various states. And they basically are doing it by population. I mean, I told them, I said, look, why don't you do it by which state